Доброго ранку всім, хто сьогодні.
Good morning, everyone who joined us. We start our working day, and the topic is medicine in Kyiv. What do Kyiv citizens think of it? Our guests are Svitlana Bubenchykova, manager of the medical group of the Reanimation Package of Reforms, Volodymyr Paniotto, director general of the Kyiv International Institute of Sociology, Maksym Parashchevin, expert of the Ilko Kucheriv Democratic Initiative Foundation, and Oleksandr Yabchanka, Ministry of Healthcare of Ukraine spokesperson. Welcome. So this research was carried out by the Kyiv International Institute of Sociology starting 15th till 23rd of January, and this was carried out according to the questionnaire that was proposed by the Center of Democratic Initiatives. This questionnaire was proposed by the Center. This analysis was carried out by our colleagues from the Center. This research was carried out by the cant method. This is a computer-assisted telephone interviews, and we carried out this the frame method, the combination of stationary and mobile phones that provides the biggest representation. And in Kyiv, there's no problem with the telephonization. That's why this data is representative for adult population of Kyiv, 18 plus. So maximum error about 4.5%. It depends on the number when they're close to 50%. So this is 4.5%. If this is about 10%, so the error is about 3%. Good morning, good afternoon. I would like to voice the results of this survey. I will try to sum up. First, concerning the overall assessment, how to understand that we can have different approach because we have such a situation. The biggest share assessed the quality of healthcare as satisfactory. Those who provided negative assessment is twice as many as the number of those who assessed the services positively. So it depends on interpretation. You may say that the scores are not bad because the share of those who provided average and provided high scores and average is more than half. And also there is a big part of those who provided average and low assessment. So if we are speaking about overall scores, this is a little bit lower than average. This is not bad, but lower than average. At that, we may assume that in this scores, there is perception, the attitude towards state institutions, because we divided respondents. We asked questions, what services the respondents used, whether they obtained it in private or in public institutions, and we revealed that those that use the state public institutions, they are twice the number of these respondents are twice bigger than the number of those who addressed private institutions. And the assessment of the services. So there are sharp differences in assessment. If we are speaking about private institutions, 90%, the high scores were provided, and less than half good assessment of state institutions. So there is 2 times difference. So the assessment those who use public and private institutions, the average assessment was even. So how do you assess overall the quality of service? What assessment would you provide to the level of healthcare in Kyiv? And also there was a question that, for example, you attended a public or private institution, and how would you assess your last visit? So the first assessment and the second assessment, they differed a lot, whether it was private or public, and the first assessment was nearly the same. The distribution was the same. So we may assume that those who used, or we may assume they use private, when they are asked about quality of services of healthcare in Kyiv, the majority, they think about public healthcare. So the public institutions are leading in their perception. So also we should note that in this overall assessment, partly it is difficult to say, but to some extent reflected is not only the objective assessment, but also the perceptions that were formed by other people or by the media. And overall assessment of healthcare services, it is nearly the same in those who addressed for medical services and those who didn't address for medical services recently. So they didn't address for medical services, but their assessment also less than average. So this assessment is formed not through personal experience, but it is formed with the use of information space. Also, the question was put not only the assessment of what is happening now, but also whether the situation improved or deteriorated. And here the correlation is nearly the same. About 40% said that nothing has changed, and about 30% they said that the situation deteriorated. So not many people have seen the improvement. And also interesting aspect, I believe, that is that better assessment of services were provided by youth and elderly people. Theoretically, we can assume that we can understand it if we are speaking about youth, because young people, they use less of the services, they have less problems with their health, and elderly people, they address healthcare system more, but they have better assessment than assessment that was provided by people of middle age. Also, of interest is the data about the availability in different forms of different payments for healthcare services. They pay for private services, and state services should be provided for free, but more than half of those who use the public institution, they said that they, in different forms, paid something. Of course, we may assume that this payment is less than in case of using private institutions, but there is such payment. So for majority of the users of state public institutions, those services that should have been provided for free, these services are not free of charge. So, and this influences the assessment of the conditions in these institutions. So not only how they provide these services, but also that these services, they are not for free. So also in connection with this, maybe Also, there is a big support of the reform in the healthcare sector. About 70% said that the reform is needed, and it is needed immediately. But at the same time, we may assume that this perception exists at the level of overall perceptions. So people believe that something should be done, but there is no clear understanding of what should be done. And maybe there is no wish to join and to think about what should be done in reality. So a smaller part of people, they were able to mention at least one component of the reform that is proposed. And it would be logic that if I believe that reform is needed and I want to actively participate, so I need to know what is going on in the sphere. But many people who say that they support reform and they believe that this reform is needed, they do not want to find out about this reform, what the reform is. So also we may say that we should say about the level of awareness about the component of the reform, and there are some distortions in this area. There is a big gap in knowledge. So less than half mentioned some of the components of the reform that are proposed for introduction. So the majority, about 60%, is concerning one point, and other points, the gap between the point at 30 or more percent and the rest is 10 or 15 or less percent they've mentioned. So even in perceptions, when they have these perceptions, they are concentrated in mass conscience. Only one component is present, and not many people know about other components. Also, the limitation in the realization of this reform is that the majority, the prevailing majority of those surveyed, they do not know who their family doctor is. And one of the components of this reform is the transfer to the system of family doctors, but the majority of the surveyed, they do not know their family doctor, or they know about such doctors, but they didn't conclude contract with the doctor. And we may say that this component of the reform is far from being implemented, or if it is implemented, it is not implemented in the way it should be implemented. Thank you.
Hello. The question was whether you can mention any items. For example, in December, we made the same questionnaire, same polling, opinion polling, with the same questions, and at that time the difference was between the number of people who knew their family doctors and didn't know. So that was the question, and then also about the question. The question was also about the possibility to get free of charge medicines. So when the mode of questioning was open, the difference was 6%, and in the closed mode, confidential, so to say, there was it was around 35%, which is probably another evidence of a rather limited interest of the public. Well, I would first of all like to thank you for your care, for your caring for this problem. The information you've gathered is very interesting and valuable to us, because the mere fact that the citizens, or the understanding of how citizens understand how they perceive this problem, how all these efforts of medical reform correspond to their needs, that information is very important. But if we speak about the indicators of the support of the reform by the public, 65% of the respondents, their answer was that they considered the medical reform of utmost importance and urgency even. Regrettably, as you can see from your description, not everybody answered, so to say, essential answer and valid answer, so to say, from this point of view of the contents. But in any case, we can see from the data that you have collated that the majority of the citizens of Ukraine are supportive of the medical reform. What's the reaction of the Ministry of Health? Last year, we conducted around 100 public consultations, 63 at the first stage, and then there was the second stage, which was dedicated or focused on the regional centers, or the oblast centers. Oblast is an administrative unit, a territorial unit of Ukraine. We have discovered, we have seen it for ourselves, that the public was needed for, better quality development of this medical reform, which means that this is a rather common procedure now of developing any crafting, if you will, any legislation of good quality. And so this public discussion, public debating of a problem that, or of an area that is supposed to be to be reformed, is it covers, certainly the execution stage and the outcomes, expected outcomes. What does the public, what do the public expect from as a result of that reform? So here we need to involve the patients, the medical doctors, the local authorities, the leaders of local hospitals and other medical institutions. These were all the agents, so to say, whom we have involved in this discussion. So they were the participants, the agents of the discussion themselves. And we have sounded out our view of the problem, and also we have heard, we have listened to their opinions, to their views, because as we can all understand, a patient has his or her perception, an official, a bureaucrat from the Ministry of Health has differing perception. If we get back again to the problems of the reforms themselves, the patients view the inconsistency between what the state promised, which was medical care or health care free of charge, as it is written in the Constitution of Ukraine, and on the other hand, and thus the reluctance of the public to pay for medical services because they refer to the Constitution. From the point of view of the medical officials, specialists and experts, they certainly are willing to be paid for their work. And certainly understanding that he or she may not expect any good payments, any compensation from the state on a real scale of their work. They expect to get some rewards from the members of the public, from the patients. Therefore, the patients are understandably satisfied with what and how with what services they receive and how are organized these services and are paid for in the healthcare system. And the doctors try to look for the ways of compensation. So these were the things that we heard from or in the course of those consultations. When the state, stops making promises, empty, so to say, promises, and start, using the funding in the interests of the patient, that's probably the goal of medical reform. And this is the option that we pursued. Probably the most debated aspect was what are the real specific ways and means of reforming the healthcare system. Well, this year is the year when the preparatory stage of medical reform is launched. Its success and its duration will depend certainly on how successful will the doctors, the medical authorities, the government will be in implementing, in attaining the results that they are supposed to attain. So, for example, the doctors need to understand how this family doctor registration stage or part is going to be executed. So that the public can also trust in the results of that reform. So every stage of this medical reform is going to depend on how successful is every part, every component, and every mechanism and participant of this reform performs his or her tasks within this reform or outlined by this reform. I hope that the results and the overall indicators of the level of satisfaction of the Ukrainian public by the results of this reform is going to increase if this reform is implemented full scale, so to say. Well, when I started thinking yesterday about what to share with you today in the course of our today's round table, the first thing that came to my mind was the recollection of my meetings and conversations with the patients here in Kyiv. For example, the patients who were entitled to get some medicines free of charge but couldn't get those medicines for free. At the beginning of last year, there were 38 government-run programs through which the Ministry of Health and the medical institutions of Ukraine were purchasing medicines for the patients. Especially the largest numbers were the medicines against hepatitis C and tuberculosis. In my view, one of the reasons, not only view, but according to the data that I have, about 2/3 of those entitled, of the patients entitled to get their medicines free of charge, were not able to get those medicines free of charge. And with the costs and prices, rather, of the medicines today, you can understand how difficult the situations turned out to be for many of them. So, within the context of this research, I would like to, first of all, agree with Sasha, and then say to you that the responsibility, so to say, for the success of this reform, it lies with, it rests with every participant of this reform. So, we know that the patients themselves, for example, might sometimes be the initiators of bribery, but not only the doctors. And the other aspect is that I very often see the very low level of knowledge, of information of the patients about their rights and about the opportunities for them to their options to get what they are entitled to. Because those government-run programs that I mentioned, they are all funded from the public funds and from the national budget. And that's paradoxical as it may seem, is the fact that the majority of the patients just are not aware of any possible ways for them, possible reactions after they are refused the medicines that they are entitled to free of charge, and for the purpose and for the purchase and distribution, free of charge distribution, of which those government-run programs exist and are funded, are being funded. So 2018 as a year of the start of the reform, the start of the reform is very important, and but I think that I see it as one of my tasks to monitor the situation, whether there are any improvements with the supply and distribution of medicines to those people who cannot afford them and who are entitled to get them free of charge. Speaking about the other medical services in the medical institutions of Kyiv, we all the time see the complaints from the patients. But frankly speaking, the beginning of these first 2 months of 2018, if compared to the previous year, they produced somewhat better results. So the number of complaints has decreased. But we need, again, to analyze the views and the outlook, so to say, for this medical reform by the medical doctors. It's going to, my feeling is that their views can furnish us another very important point of view and the data that might be and probably will be useful in the course of this reform. Well, let me add that each side of that medical reform is interested in, fair rules. But the problem that arises here is that the patients sometimes view these rules their way, and the medical doctors and medical authorities their own way. And the key question here is how can the medical services be priced? The medical doctors and medical specialists would like to understand how the treatment process needs to be organized so that they are compensated fairly for their work. And the patients need to understand and want to understand whom they are treated by, who are their doctors, how that treatment is, this treatment can be reorganized and made more efficient. So what is needed now is to write those rules down so that they are acceptable for both sides of this healthcare process, both the patients and the medical community. Thank you. Colleagues, ladies and gentlemen of the public, would you like to ask any questions? Well, can anyone of you explain a nonsensical situation with which a lot of our readers confront or face? We know that the majority of the recipients of those entitled medicines are those who suffer from heart problems and some other severe illnesses. But what about the oncology, those people who suffer from cancer? The medicines that cure cancer or treat rather cancer, they are very expensive and unaffordable for the majority of the patients here in Ukraine. I think this is the question that is directed to me more than to anybody else, because I represent here the health ministry. Well, the programs for the entitled medicines to the for cancer treatment, these programs exist. They are funded. The problem here is the amount of funding. The National Budget Act provides for only 2.6% of the GDP as the amount of funds to be spent on healthcare. This is a low figure. So the medical doctors are obliged by the law to provide medical treatment and all medical services free of charge, but we simply, as the doctors, as the medical community, we do not have those medicines because we need to buy them and we do not have funds for that. And in order for these free of charge treatments and this, provision of the Constitution be substantiated, the state must provide funds, and so we need to have clear picture of the prices of the medical services for everyone. And these prices should be established.
So there should be a number of funds, of cost of service, and how many such services are needed for Ukrainians in order to calculate all this. Until end 2019, the ministry have to calculate the cost of services and to calculate real need in those services among citizens of Ukraine. So what it will be? The Cabinet of Ministers will submit it to the Supreme Council for adoption, and the Supreme Council will vote for the budget, and together with this, they will also vote for the package of state guarantees, and there the cost will be established and what amount of money will be provided by the state. Because in order to provide for the patients, we need proper financing that corresponds the promises of the state. So there is a parallel process. It is not easy, it is rather difficult, but it is possible. And medicines to treat cancer, they are expensive, and many of them are patented, and some pharmaceutical companies dictate prices on the market, and until this company has a patent, only this company can produce this medicine. But there is an experience when patient community, together with international partners and patients in Ukraine, carry out negotiations with pharmaceutical companies in order that they go to tenders with lower prices. These are all details, but I can mention one example. This is network of people who live with HIV/AIDS, and they forced Gilead company to help them to decrease the price for the medicines for treatment of cancer. Do you have other questions? If there are no, that would be interesting to see the results in 1.5 years. So to see what will